Conversation.
What's the problem?
Recently, I have had difficulty breathing. I notice my face, fingernails, and lips are so pale.
Do you feel easily tired?
Yes,
Have you lost weight?
yes, it's because I have no appetite.
When was your last medical examination?
6 months ago.
Okay, let's make a thorough examination to be sure.
Conversation.
Okay. What's wrong?
My daughter has a fever and her tonsils are swollen.
Okay, please tell her to sit on the chair.
Okay.
Let me check. Please open your mouth wide, little girl. Is this the first time for her to have this trouble?
No, she has this problem twice a month. What's wrong with her, doctor?
She certainly has tonsillitis.
Is it serious?
It doesn't seem to be serious. I'll give some medicine for her. Give her 3 teaspoons of this medicine 4 times a day. If she is not better, please come again. And if she has a high temperature, rub a wet towel over her body and then dry her. It can relieve the fever.
Okay, I'll do as you say.
Thank you very
Conversation.
much.
My son is 1 year old, but he still has jaundice.
Is his bowel movement usual?
I think it's normal.
And what color are his stools?
They are gray and quite black.
Do you breastfeed him or give him formula?
I don't have enough milk, so I also give him formula.
Okay, he needs a thorough examination.
Is there anything serious, doctor?
I can't tell you anything until we have the results of the examination. Please, conversation. I have a stomach ache and my stomach feels bloated.
Do you feel nauseous now?
A little bit.
Are there any other symptoms?
Yes, I've found that my lips and my tongue are very dry.
Okay, you should drink a lot of water.
And what about food? What should I eat?
You should eat liquid food until you feel better. I'll give you a prescription. The pharmacist will tell you how to take the medicine.
Okay, thank you very much.
Conversation.
I have pain on many spots of my body.
Where does it hurt?
At the joints of my knees, ankles, elbows, and wrists.
Anywhere else?
No,
How long have you had this pain?
about 2 months.
I want you to take a physical examination.
Of course,
No
conversation.
problem.
What's the matter?
My daughter often goes into convulsions. I don't know what to do. What's wrong with her?
Please take it easy. Does she have a temperature?
No. When she goes into convulsions, her face is very pale and her eyes roll back. What's the best way to help her? Should I give her some medicine to prevent convulsions?
I don't recommend that just yet. And does this happen many times a day?
Yes, about 3 times a day.
Okay, you should take her to come to see me.
Conversation. There is a rash on my son's body, and he has a cold as well.
How long has he had it?
About 2 days.
Does he have a cough and a runny nose?
Yes, he does.
He seems to have measles. Are there any children with measles in his class?
I've heard that his friend was absent last week because of measles.
Okay. You should keep him warm if he has a high fever, but don't let him get too hot.
Can I give him some medicine?
Yes, you can give him paracetamol for fever.
How long will it take to go away?
He should stay in bed for about 3 or 4 days until the rash goes away.
Is it contagious?
It would be better if you kept him isolated until he recovers.
And should I take him to see you regularly during recuperation at home?
It's unnecessary, but the disease can cause inflammation of the ear and pneumonia. So if there is anything unusual, please bring him again immediately.
Conversation.
I don't know what's wrong with my daughter. She has little spots all over her body.
Does she have a temperature?
A little bit.
Let me see the rash. The lymph nodes under her arms and at her neck are swollen. It seems to be German measles. Does she have a cold and a cough as well?
No.
Are you pregnant?
No, I'm not. What's the problem?
I just want to know because it would be very bad for the baby to get German measles, unless you had German measles already. Have you had German measles before?
Yes, I have.
It would be all right if you are pregnant then.
So, when will she recover?
Don't worry. It just takes about 2 or 3 days.
Okay. Thank you very much,
Conversation.
Doctor. My son has a terrible rash.
Where does he have it?
On his chest, tummy, and hairline.
Let me see. Does he have any blisters or black spots somewhere?
Yes, but they seem to be forming scabs.
When did the rash appear?
3 days ago.
Does he have a fever?
He has a fever on and off.
Okay. He seems to have chickenpox. He should stay in bed for at least 3 days. Then he will recover naturally. You should not allow him to scratch because it will leave scars.
And is it contagious?
Yes, it is. If he has sisters or brothers, you should keep them separate.
Okay, I understand. Thank you very much.
Conversation. What's the matter?
My sister's cheeks are swollen and painful.
Can she open her mouth?
When she opens her mouth, it hurts, especially the area below her ears.
Does she have a fever?
No.
And does she have a stomach ache?
Yes, sometimes she does.
She seems to have the mumps, so she should take a rest until the pain is gone.
Should I give her some medicine to relieve the pain?
You can apply a wet compress to her neck and give paracetamol. It will relieve the pain, and you should not give her anything sour to eat. It will aggravate the pain.
Okay. I'll do as you say. Thank you very much.